Hello ladies and gentlemen, Ollie here and welcome back to the channel once again for another of these diary entry videos. I said last week I was going to try and get through this much faster. That didn't happen and it was actually the longest one of these I'd ever done. So this week we're going to try and make it slightly shorter because I've got a lot left to do tonight and I need to get this done. So straight in, Monday morning was quite heavy. We actually had 3 lectures on the structure and function of the heart again, kind of the electrophysiology side of things, and this served as our proper introduction to ECGs, electrocardiograms, and it became apparent that there was going to be an enormous amount of material to go through. There was a lot. I think the ECG side of things is going to take a little while to get used to, but more on that towards the end of the video. Monday afternoon, a very sad and traumatic thing happened. I've spent a little while doing some flashcards for Block 2, in preparation for this upcoming formative that we've got at the end of next week, and I found out that none of my Block 2 cards have saved properly, and it was because when you use Anki, if you don't save your collection of cards with a different name than the default collection, which is just called like collection.anki package or something like that, it actually overwrites the default one. So, because I hadn't changed the name, I just called it collection. I think as soon as I opened an old version somewhere else, it saved over it. I'm not entirely sure what happened, but long story short, all my Block 2 flashcards are gone, so that's very irritating. To be honest though, I think that at least my experience with Anki has been that by far the most important part of using it is actually writing the cards for yourself and trying to predict questions. Obviously there will be some level of benefit to going through the cards for revision purposes, but I think trying to do it purposefully and having written the answers yourself provides me at least much more of a learning benefit. So on Tuesday, you may remember of last week, I had my first community day, and so basically what we did was we went out to a given community. Our clinical placement base is in Southam, about 20 minutes past Leamington, and we went to see a patient, and basically we would interview them and ask about how they were managing with their condition, what their kind of life was like. It was a really interesting day. Please go and read the entry that I wrote in the blog that day. It's got a lot more detail than I can go into here because of time. But anyway, this week we were tasked with giving a presentation, a 15-minute talk on what we'd learned and trying to place it into some kind of academic context, like linking it to what we'd done at university. And so naturally, as is the way with presentations, we had some people that were busy over the weekend. We were all very busy ourselves. We actually met up the day before, so we met up on Monday to kind of determine what we would all be contributing to the presentation, and that was why I was awake at 5:30 on Tuesday morning, frantically piecing together this presentation that we had to deliver at 9:30. The thing I really took away from the presentations though, because there were us and 2 other groups, so 3 presentations in total, and it was very, very much about the societal aspect of things, social factors, I mean, rather than the medication and the pathology. And I was actually really impressed. I think all the groups, ours included, managed to really capture the personality of the particular patient that we'd been to see. So even though, because of confidentiality, we had to completely anonymise everything, so there was no kind of clue as to who the patient was, I think we really captured, as I say, their personality quite well, and you felt like you knew a lot more about the patient than you could have done from the information you were provided. It's difficult to explain, but I hope that's come across properly. And I did say 15-minute time limit. None of us managed to keep to that. Our group went last. When the first group went, I think they were at like 19 minutes or something. And we'd, as our group, been worried about actually making it to the end and lasting out the 15 minutes. Our group was the most sluggish and actually came in at 24 minutes, although that did include a reading of a poem that our patient had given to us, so whatever. That afternoon as well, we actually had a talk from a smoking cessation expert she specifically worked with pregnant women. I think that was her kind of area of interest. It's apparently much more difficult for pregnant women to stop smoking than kind of background smoking patients, although I guess it's quite easy to imagine why. And there was a thing in there as well, it was to do with the formulation of cigarettes, like using substances like ammonia to, I think she said it increases the sensitivity of certain receptors that you have to nicotine, so it makes them more addictive. And I thought, oh, that sounds awful, but then I guess they're a consumable product, aren't they? If you were running a tobacco company, although it is a bit scummy, I guess it's the kind of thing you would do. Now, Wednesday was an interesting day. So we had CBL in the morning, and the case actually, the way this case, or not this case, but CBL in this block has been structured is that we're asked to do things, or asked to interpret things that we haven't actually covered yet, just because apparently that's how the block lead likes to do things. But this caused a bit of a problem because we hit a block of ECG stuff that we had to understand, and we kind of ground to a halt because we'd had our introduction basically on Monday to what an ECG was and kind of how it works, and had full days the previous 2 days, so between now and then we'd had very little chance to go over what ECGs were, and it was really difficult. So we basically decided to kind of, we'll move on from this and dedicate some time in another session to ECG practice. And I think it's getting quite visible now, even with people in the year, stress is starting to build up. We've only got this assessment to do, we've got our clinical OSCEs, which will be a bit of a hurdle, but then we do have the Christmas break. We've got 3 weeks, I think, so I think everyone's looking forward to that. That afternoon, I went to an optional ECG lab session, which is really good. I think most people had gone in the morning, so there were very few people there. I think there was 4 of us in the entire session, and there were 2 demonstrators, so it was a really good staff to student ratio. So we got taken through how to do the process from start to finish. We put them on ourselves. Ripping off the conductive pads that you have to use was really painful. So we did that. We had a demonstrator talking us through it all, explaining it to us while we recorded our results, and then we actually had a cardiology nurse talk to us for a little bit about it, and that was really interesting, hearing the clinical contexts of them. She gave us some really helpful tips just to very quickly interpret whether someone's in danger or not, and just having someone who knows what they're doing explain it to you one-on-one is really helpful anyway, so I'm really glad I went. That evening, it was actually my housemate's birthday. I mean, obviously not just in the evening, it had been his birthday the whole day, but we celebrated it in the evening. We went out for a meal at Fox and Vivian in Leamington. The food was absolutely delicious. I had a burger for the first time in a long time. And when I got home on Wednesday, actually, I was super happy to have waiting for me a signed bookplate from the comedian and ex-doctor Adam Kay. I don't know whether you'll be able to see if I get it in focus frame. I'll put a picture up as I'm talking of his book, This Is Going to Hurt. I really strongly recommend it. But Adam Kay, so he was an obs and gynae registrar sometime, kind of went through medical school, formed a band called the Amateur Transplants, which I'm sure many of you will have heard of. Look them up, they're really funny. It's like a comedy band with medically themed songs and parodies of other famous songs in some cases, and then if you read the book you'll learn more about this, but I think he just became disillusioned with the way the NHS was going and the stresses that he was having to deal with, and left his job and became a comedy writer for the BBC full time. He's a really nice guy. He seems to read my blog because he's called me out on things before that I've gotten wrong, but he's a really nice guy. Go check out his Twitter, Amateur Adam. His book's doing really well, so buy the book. It's a great Christmas present and it's really cheap as well. So I'm really happy I'll be able to put this this bookplate in my copy and have it personalised. Thursday was quite interesting. We started a new CBL case. This one had less physiology to go through, so we were a bit more comfortable. It was more about pathology, which we knew a little bit more about, so that was helpful. In the session opposite CBL, I actually managed to get about 90% of my anatomy book done for the week, so that's a very rare occurrence. Normally I don't manage to finish it. I do manage to get all the core anatomy done, but the radiology and some of the seminar work I don't always get to, because I always try to focus on the anatomy as the bare limit to what I'm going to get done. But I went through the 3D structure using that anatomy software of the heart really, really slowly and carefully, and being able to visualize it in 3D makes all the difference. That evening, I actually met up with a school friend of mine, like my childhood best friend from back home, and he is actually now completing his master's year at Warwick, so he came here to do his undergrad. He's now doing his 4th year. I obviously went off to Newcastle, but now I'm in my 4th year of uni, so actually there's a bit of overlap. So we decided to catch up, and I'm really, really glad we did. He's doing really well for himself, just got an internship with a banking firm, so obviously really, really happy for him. And he's a kind of economics genius, so it was really interesting talking about things like Brexit and the NHS, and the intertwined effects from his perspective, because obviously he'll look at it from a different angle than I will. And I was talking to another friend recently as well. She has just started working for O2, and it's just really bizarre to think that some of my friends are actually like, they're starting their careers now. They're getting feet in the door, whereas I've gone back to uni for another 4 years. But at least when I come out, hopefully I'll be doing something I enjoy. And we all got back from uni quite late last night. I think it was about 9 o'clock when we got home, and all of us were really tired. We decided to cook really cheap and horrible but really delicious chicken nuggets, and we put them all in a big dish and just went downstairs and ate them tragically in the living room. It was a good bonding experience, but as I say, very, very sad. So Friday, hospital day, MEC, making every contact count. That was the theme of the day. It was a bit of a frustrating day, to be perfectly honest. So what MEC seems to be all about is that if you make an intervention with someone, so say during a consult, someone mentions that they drink, say that they drink, I don't know, 6 units a day or something, and from what I understand of MEC, it seems to be about using the position that you're in and suggesting positive steps. There are 4 A's that I can't remember, like assess, advise, but a step-by-step process that you can take people through, which makes them more likely to give up whatever harmful behaviour it is that they're displaying. So this was using things like the trans-theoretical model, I think it's called, so pre-contemplation, contemplation, preparation, action and maintenance, I think, with regards to keeping people off these damaging behaviours and working out whereabouts on that scale they sit, so how motivated are they to actually change their behaviour. And I think the reason that a lot of us found it frustrating is not the concept. Again, I've said this before, but we know that this type of thing is important for good healthcare. I don't think anyone disputes that. But the lecture was an hour long, and it just felt like the same thing was being said over and over and over again, like 10 minutes worth of material spun out over an hour. And we had an entire afternoon session on MEC as well, in place of clinical skills. And just with the OSCEs coming up, it felt very frustrating, and I think this is something that we're either going to have to simply get over and learn to accept, or take some proactive steps in trying to change how things are done, which is something that I'm absolutely sure the university would listen to us about if we put together a sensible plan. So like I've said, we also had anatomy, and I'd prepared really well. This has been the second session. I had one in block 1, I've had this one in block 2, when I felt really, really on it, done all the preparation. And actually for the seminar as well, I managed to get all the embryology pre-reading done and was able to follow it and contribute. Just, it's such a rare but kind of blissful experience when it happens. So on Saturday morning, I was going to go for a run. I've done that I think 3 times this week. I got up at like 6 and gone out. It's been really cold, but I feel really good afterwards. So I was planning to do this on Saturday morning. I absolutely did not do that. What I instead ended up doing on Friday night was staying up late and watching terrible comedy movies, because it seemed like a good idea at the time. Because I've just got this Fire TV stick, everything is now directly in front of me, so I stayed up watching Horrible Bosses, which was enjoyable. It wasn't great, but it was funny. And I also started watching that new series about junior doctors, Blood, Sweat and Tears, I think it's called. So I watched the first couple of episodes. Some of the people in it I find a tiny bit obnoxious, but I think I probably need to get a bit further into it to let them warm up on me a little bit. I really enjoyed how kind of realistic the approach is. It's not jazzed up or anything. So it focuses on foundation year junior doctors and the different wards that they're on. And one of the female doctors was actually on a respiratory ward, and given that the first half of our block has been respiratory medicine, actually being able to follow some of what was going on was really nice. So Saturday morning I tried to blitz out a load of Anki cards, basically focusing on the upcoming OSCEs, because I've given up being able to do the upcoming formative assessment. We can do them open book. With the first one I did it closed book at first and managed to pass closed book. This one I don't think that's going to happen, just because the pace of things seems to have been a lot, not worse, I don't want to use the word worse, it feels like it's been more overwhelming in terms of the amount of new material. And with the loss of my Anki cards as well, that was very, very demoralising, so I need to put steps in place to make sure that doesn't happen. Yesterday afternoon, we actually went looking for a house for next year, the three of us. We want to stay in Leamington, preferably the north side, and getting a house with a 3-bedroom place. I think trying to find a house for 3 people is just going to be so much easier than trying for like 6 or 7 or whatever would be more common with student housing. And on our way down to the south part of Leamington, where all the kind of student estate agents are based, we came across these people dressed up in Star Wars clothes. So there was someone, I think as Princess Leia, and then 2 clone troopers, and we decided to go and get our picture taken. And I say we because 2 of the 3 of us went to get pictures taken, with our 3rd housemate protesting that it was too cringeworthy. So he stayed behind while we went and giggled and went and got the pictures done. And it's gotten really, really cold recently, so we actually decided to go and get a hot drink at Coffee Architects in Leamington. It's a kind of independent thing. Most places in Lem are chains, so it was nice to go to an independent place, and a lot of people in our year have been raving about this place, and actually from going it's really, really easy to see why. So we went in, it was absolutely full, but because there was only 2 of us, me and Emily went, they said, do you mind, like, you can come in but you have to sit outside at the back, kind of on the patio, but there's heating and we'll give you blankets and hot water bottles and stuff. So we went out, and it was really, really warm, kind of on this decking with a heater overhead. So Emily was sat on the far side, I sat towards the cold bit of the garden, but I had a hot water bottle on my lap that I was cradling. And so we had 2 really, really nice hot chocolates, some cake, which was absolutely delicious. You get an enormous slab of cake, clearly designed for 2 people. And we actually ended up chatting to a lady on the next table over, who I think was friends with the owner, or one of the staff members of the coffee place. She said she was retraining. I think she'd just been made redundant or something, sadly, and so was looking to enter a new industry. And so we kind of mentioned that we'd just moved down to the area as postgrads, both of us completely new to Warwickshire. It was really, really nice, heard some interesting stories. And that brings us to today, just domestics really, again working on my Anki deck. I've been putting together a presentation on behalf of my CBL group, all about ECGs, the ABCs of ECGs it's currently called, because during our last session I took it upon myself, because I knew that I was going to the optional labs to completely learn like what we need to know about ECGs, prepare a presentation. And actually I was talking to our block 3 lead, so she teaches the neuro block that we'll have after Christmas. She said to me that she had a portable ECG machine that we could borrow for our CBL session, so I'm going to take people through the basics from scratch, and then we're going to take each other's ECG readings and then place it in some kind of context, so I'm really looking forward to that. But that's it guys, that's where I'm going to end this video for now. This is week 9, god, nearly there, nearly at the end of block 2. Thank you so much for watching. Please be sure to hit that like button for me, leave a comment, subscribe to the channel, and don't forget to leave any questions or comments you have down below. I hope you've seen the Q&A videos that I've started making. Response to those has been really good. I'm really happy about that you're enjoying them, and I can't wait to make more. Just keep the questions coming in, I'll record them when I have time. So take care guys, good luck with your applications, those of you that are in for this year, and I will see you next week. Bye bye.